Welcome to our Future Focus series today. Our guest today is Hannah Fedema. She is a registered medical assistant. She is a former certified nursing assistant and a direct support professional. And side note, she is my daughter as well. So very proud of all that she's accomplished, but she has a lot of wealth of knowledge in this area, working in geriatrics and also as a registered medical assistant. So I feel that she's a good guest for us today. Guests will be muted during this session. Please use the chat feature to ask any questions, and this session will be recorded. So as I go back, so Hannah, tell us a little bit about who you are and kind of maybe the difference between a direct support professional, a CNA, and a medical assistant. So we have kind of an idea.
I'm so sorry. You can totally see my cat in the background doing her thing. All
yes. Good.
So certified nursing assistant, you have to go through kind of more schooling, a little more steps. I think when I was in school, the option was stepping stones, which I don't know if that's still now, but that was, we would go there, almost like night school for X amount of weeks. And
you had this high school, right? You were going
yes.
to this DTC? Yes. Okay.
Yes. Again, that was another really awesome program that they offered. There for second year Health Science Academy students, we were either able to, you don't have to do anything, but we were given the opportunity to have CNA courses paid for, which can be pretty expensive, or pharmacology tech, I think was the other option. And so I think most people did CNA, but there was a good handful that did pharm, and I think only like one or two people that opted out. So, because it was a great program, and you got to do it with other people, so you had more support. And Miss Andrews was very lenient with, if we had night classes that night, we got a little extra time the next day in school to get things done, or to work on our homework, or to study or practice our CNA skills. To prepare for a test, because once you get through the courses and you pass the skills, you have to prepare for the state exam, which you have to sign up for and complete within X amount of days. And so then you have the certification that you're a certified nurse's assistant, and you can work in nursing homes, especially Rachel, I believe, my little sister, who is a CNA, she's in the hospital, so you can do that as well. Direct support staff is, you're a direct support staff when you're a CNA too, but a lot of times for direct support staff, you don't need that CNA license. So like assisted livings, private duty home care, you don't have to have that CNA title. It's helpful if you do, but you don't have to have that. But in nursing homes, hospitals, you do. So, and then medical assisting was this little step further. I went into college for that, and that was an accelerated program as well. That was about a little over a year.
I was going to say about a year and a half MCC program, right?
Yeah. And that was a good program. Again, it was, we did a practicum where we would intern at an office of our choosing, or a setting that in the medical field that we were interested in. I did geriatrics, of course, and we studied all year and had to pass, it was kind of like a CNA program, but this was college level, so we had professors and things, on that kind of scale. We had some prerequisites we had to do. And then past that, everyone, you had to take the big, again, test and become a medical assistant, CC. And a lot of people would take that a step further, and they were using their MA as a step to continue into nursing, or, that we even had some physical therapists in our medical assisting class that were older and just wanted to do something else. So, and then there's people like me who wanted to stick in this field for a while and see what they could do with their MA. And, because the MA is, a lot of times you just think it's the doctor's office, but I was able to stretch that. So
yeah, you were. And I think just for our audience, medical assisting, when you go to your doctor's office, those are the people that kind of take your initial intake before you see the doctor.
Yep.
They kind of take your temperature, ask you those beginning questions, do that beginning charting before the doctor comes in to see you. And so, this week is Nurses Week, and I wanted to not only honor our nurses, and I think a lot of students are familiar with, going into nursing and what that looks like, an associate to a bachelor's, but wanted to highlight other paths that can lead up to nursing or that require less than associate's degree and kind of are that beginning stepping stone getting into healthcare, like you highlighted, direct support worker, working in those, or a CNA or an MA. And like you said, many people use those as stepping stones into nursing. So let me ask, when you were like 15, 16, 17, which from my lens as your mom doesn't seem so long ago, but I'm sure it seems like eons ago to you.
Yeah.
Did you ever did you ever think that you would be a registered medical assistant or even take it to the level that you did when you were 15, 16, 17?
Yeah, I think I always wanted to work with the elderly population. So, at the time before, I think the Career Tech Center, it was just if you want to go into healthcare, you're a doctor or you're a nurse. They didn't really explore too many other options or stepping stones. I would go to the doctor's office and see all these different people, or you go to the hospital and see all these different people. But, in school, they, at least when I was in school, they just kind of, so you're going to be a nurse or a doctor if you're going into healthcare. And you're like, sure, that sounds good. So I think I really wanted to go into registered nurse geriatrics to some extent. And that's what I entered the CTC with my first year. And then my senior year, that's what I was still really gung-ho about until, we started really doing a lot of like job fairs and really exploring the different pathways and careers out there and different stepping stones and the intricate levels to get to be certain things. It's not just like you get your degree and go into this position and that's it. You experience and you really have to work, and you can take like your medical assistant and grow that so much. So yeah, I always wanted to be in geriatrics, but I felt a lot of the times nurses in geriatrics were charge nurses passing medications, or kind of sat a little more behind scenes. And I was like, man, I really want to be with them at their bedside. I don't want to just be going over their care plan and passing medication. I want to be a little more involved in, which some people don't want to be, helping
Sure.
transfer or helping them shower, things like that. But that was something I felt that was, a special vulnerability, intimate moment that you have to have a lot of respect for to be able to do. And so I felt that that was something I really enjoyed, being able to share that kind of moment, but also make them feel very comfortable and safe and have an actual relationship with them.
I think that's important to highlight that within healthcare, there's lots of different things that you can do. Like you said, you can be behind the scenes, or you can be that direct patient care, or you can even be in billing and things like that. So there's lots of different areas, but you're still within that realm of healthcare. So Hannah, share how you took your MA, which like we said, traditionally in a doctor's office setting, helping that intake. Share how you expanded, how you were able to use your MA in your role with North Ottawa Hospice.
Yeah, so I was overly confident in myself that I could take my MA and just push that and see what I could really get myself into doing. So that was kind of fun. So I was working at an assisted living while I was in school at the CTC and into college. Then when I got my MA, I had been there for a while, and in the state of Michigan, you don't have to be a registered nurse to be a director of nursing type role in an assisted living. So I worked with our director of nursing, who was a nurse in our Grand Haven location. There was 2 assisted living locations, one in North Muskegon, one in Grand Haven. And I took over as a clinical care coordinator at the North Muskegon location. So it was a 60-bed assisted living with a locked unit. I was in charge of staff and new patients, residents coming in and out, and doctor's day and medication orders and all that kind of stuff. So it's kind of chaotic for like a 19-year-old to do. But I really enjoyed it, and I knew everyone there, and it was a great a great big girl job. It was a lot, but I really enjoyed it. I think I really loved the patient care, and with being a director of nursing type role, a lot of it was patient care, but still a lot of it was at my desk, filling doctor's orders, talking to families, hiring, working with staff. So I wasn't, scratching that itch of, oh, I want to be more than the snapshot of the resume. I want to be more involved. So we used Hospice of North Ottawa for a lot of our patients, which I thought was interesting because we're in North Muskegon and they're a Grand Haven, known as kind of a Grand Haven type hospice. So, but I quickly found out why. They were incredible community-based hospice that, works within like a 30-mile radius of Grand Haven. So they were a really great program, and they had a liaison who was a nurse. She would do evaluations. She would do a lot of community involvement. So she would do wonderful things for us, but also our patients. And it was just, I was like, wow, what is more special, and then being in hospice? Geriatrics with a sad, but also inevitable part of someone's life. How cool would it be to work in hospice and be able to make a difference there at the most important stage of someone's, life, birth and death, So, and I know I didn't want to work with babies. So I was like, how cool would that be? But I'm not a nurse, and everyone in hospice is like a nurse. So that's not going to happen. But the liaison left after a few years. I think her and her husband moved, and I went on Indeed, and they wanted a nurse for the position. And I applied anyway. So I'm like, don't care. They want an RN, I'm going to apply anyway. And then she called me,
Sometimes
the
you
boss.
don't know until you try.
Exactly. So I applied, and they called me the next day for an interview. And I was like, so geeked. I was like, does she know I'm not a nurse? Are you sure? But I went in there, and it was perfect. And I think I had a second interview with the medical director, Dr. Vanderhyde, and the boss, Kim. And again, everything went great. And there I was. So I was there for over 2 years and was a clinical liaison. So I was out in the community. I was meeting with patients and families at the hospital during this intimate, hard time, talking to them about hospice care and what we could do for them and how much quality of life we could provide for their loved ones. And it was such a great time. I got to do a lot of fun stuff, marketing type stuff, but then I also got to do a lot of patient interacting. And especially during COVID, we got to find new ways to support clients or patients that couldn't get out of their home to get necessities and things like that. So it was so fulfilling. It was wonderful. And
I think
yeah.
that showed, how you were able to, stack those credentials. That's first CNA, you worked as a direct support first, then CNA, MA,
Yep.
and use the heck out of that MA, credential. We have a question from someone that's saying, what advice might you give to current seniors who aren't sure about their specific career path, but they know they want to go into healthcare?
Yeah. I would
What would
say
be
it
your advice?
is, it is so hard to really know. I remember when I graduated, and we all knew, what we wanted to do, right? I knew I was going to be a geriatric nurse. We had people that knew they were going to be anesthesiologists and all these big eccentric things. And you don't know until you really start school and really get a grasp on what college is like. The CTC gives you such a great in and so much experience, and I'm so grateful for that. But you can never really 100% be ready for college and ready for what all healthcare requires until you meet with a counselor and start your prereqs and things like that. So I would say try to keep an open mind, you know, really explore. Job shadows was huge for me. I really loved getting to talk to different people in different fields. What a date, because being a nurse might be great, but maybe you don't want to be the nurse that's at the doctor's office working the 9 to 5 behind the scenes, just answering the phones. Maybe you want to be the ICU nurse, and, so really, or something total, a pharmacist, so really looking into that type of stuff because it's so broad, the healthcare system. So don't be hard on yourself. Really keep an open mind, and dig down into what your passions are. That's true. I loved geriatrics, and that opens hundreds of jobs for me. And so that kind of helped narrow it down a little bit. But you want to do what you really enjoy. You don't want to be a nurse doing something you don't love. And you got to be passionate, especially being in healthcare. You got to be very passionate about what you do.
So how did you land on within healthcare, the geriatric field? Like you said, dug into your passions. How did you know that one was the right avenue for you as opposed to pediatric or hospital or
Yeah.
or anything else in healthcare? How did you know that geriatrics was that avenue for you?
I think for me, it was, I would, since I was a kid, I would go to the store or to breakfast or the farmer's market, and I would see those sweet old men with their World War II hats on, and I would just die over them. I thought they were the cutest guys. I thought they were so sweet, and they were always I always just had great experiences meeting, people that were my seniors. Just they were always so warm and welcoming, and they were so knowledgeable, you know, so incredible. The things they've seen and the things they know, it, I mean, I should be paying them for the information I get from them. It's incredible. So I thought they were just this gold mine of incredible people who've had lives of decades of years of experience, and have been through so much. And I'm like, wow, they deserve the best care. And the United States is one of the only countries that don't really do, I think it's called the sandwich generation, where your loved ones live with you. The elderly are highly regarded in a lot of other countries, more so than they are the United States. Not that nursing homes and assisted livings aren't essential, but I've seen a lot of sad situations where it's just mom or dad is just stuck there and the
Yeah.
kids never come to visit. And I wanted to make a difference in that, avenue. And I thought they were just such a population that needed more of a voice and needed more of compassionate care. And so that just stuck out to me more than a crying baby.
Yeah, I think that, having, as your mom and having two daughters in healthcare, I think it's important for students looking into healthcare to really know who you are. You're a very outgoing personality and you love to talk to people. My other daughter, who's going into nursing, really doesn't want to be involved too much with talking to people or patient care. That's why she wants to go into surgery. She wants to fix. So, know your personality because there's a place in healthcare for you. You
Absolutely.
just have to find your niche. So I agree with that. So let me ask you, what are the traits, talking about students that looking into healthcare, what are the traits that would be important to have or skills that would be really important to have going into healthcare?
Hmm. Well, you definitely have to be passionate about it. I'm big on passion. That's always going to be number one for me. If you're in it for the money or the fad of being an RN, it's not going to work out for you. You're not going to love it. You have to be committed. Um, MA was hard, but it was also, I did better in college than I did in high school because I really enjoyed it. I loved what I was learning, and I knew that that was going to apply to my life. So that was easier for me. But if you talk to my little sister, who's soon to be an RN, she's dying with the classes, and it's really hard. But she is a great A student who's struggling. So you got to be committed. You got to just learn to lean on other people and your teachers, and go easy on yourself. So I think you got to be committed. You got to be passionate and patient, which is a hard one for me because I like things here and now, and nursing and beyond takes a lot more than just the here and now. It's going to take a while, especially with the demand. So
I think that's important to
CNA,
point
yeah, CNA and RMA was just a good way for me to really get in the door and kind of go from there. But for me, going from there, I was able to do a lot with that without having to get that 4-year degree or things like that. But for other people, that maybe not be, that's just a stepping stone. And for a lot of people in my class, that was just the stepping stone. And, they're in nursing school now and they're working as an MA to help pay for nursing school or things like that. So,
Well, and I think too, a lot of times, if somebody has their CNA or MA and they're working for an organization like Mercy Health, then that employer can help offset the cost as you continue on if you want to go on
Yeah.
to nursing. Now, there are many people that are MAs, love that. That is their niche and make a good living doing that and really enjoy that work. I have another question that came in. What are the hours like? Night shift, day shift? What are the hours maybe like as a direct support professional? What are the hours look like for a CNA? And what would the hours look like as you were working as an MA? Just to give people an idea.
Yeah. So direct support and CNA is really flexible. Depending on what you do, there's night shift and split shifts first. I mean, it's so broad. It's kind of nice. You can pick your schedule a lot. I would have, when I was a director of nursing, I would hire CNAs or direct support staff, because in assisted living, you didn't have to have that. A lot of the times the CNAs were med passers as well. They would get trained to pass medications. So we would have people that could work full-time to 3 days a week, to only first shift, to only third shift. It's such a broad spectrum. It's really manageable and moldable to what works for you, especially in school. That was the other great thing is my boss just really worked around my schedule. And I think there was a time I was working 1 day a week and then every other weekend, because that was what I could do. And they were just so supportive of that. And I'm applying the skills I was learning in school at my job, which was really helpful. I think, it's to me, it seems silly to go into healthcare, but be working at, Starbucks or something. It was so beneficial to me to be in healthcare as I'm learning healthcare. It was great. But a lot of the times in direct support or CNA work, you are required to work every other weekend to 1 weekend a month. Sometimes that's, moldable, you can flex that a little bit, but a lot of the times that is one of the big reoccurring factors in those type of fields. But RMA, it's like a doctor's office. You got the 9 to 5. When I did my internship at the geriatric office in Muskegon, it was a 9 to 5, 4 to 5 days a week for some of the girls, an hour lunch. And it was very just like that 9 to 5, it's that job. Being a hospice liaison was really nice because I only worked 4 days a week and it was like 8 to 4, but my hours were able to flex a lot because I was all over the place. Or if I had a marketing event that night, I could, sleep in the next day. So it was really flexible. So I think it really just depends. If you're in a doctor's office, it's pretty much always going to be that 8 to 4, 9 to 5. But, there's a lot more flexibility.
Yeah, like you said, with the CNA, a lot of flexibility for those that are students, maybe going to college or other things.
Yes.
What are some things that you see might be changes or things that are developing as we move forward or have moved through this COVID space that are changing in healthcare when it comes to direct support professionals or CNAs or MAs? Do you see any changes that are on the forefront for any of those positions? Hi, Cece.
She's a hot mess. Yes, I do. I think it was really hard for a long time. The staff would get burned out, and the residents were just getting so depressed. So I think a lot of the big things that really changed are staff burnout's a real thing. Giving so much of your time to others is so very rewarding, but it's very draining too when you're carrying, sometimes the burdens and emotions of residents and things like that. So I think what I've seen throughout this process is a lot of restoring things they're doing in healthcare. Nurses, CNAs, RMAs, we'd get mindfulness time. Our boss would hand us out meditation cards, and it was just more focused on our well-being versus how efficiently we're working, because you're going to work more efficiently the more you take care of your mental health. So I think that's been a huge thing. That how many times do you see just frustrated staff members just yell at someone, or that frustration. You have that in any field, but in healthcare you don't want to have that at all, especially. You always want to be patient with who you're working with, especially in an older population, with someone that maybe that has like dementia or Alzheimer's. So mental health, I think, has been just a huge focus throughout COVID. Is for residents too, more activities that just engage their mind, not being able to see family, that's been a huge thing. So though a very horrible thing to go through this last year for healthcare and assisted livings and nursing homes, there's been a lot of growth, I think, that's come from it, of more of a focus on the mental health of just not only staff, but these residents who can't see their family and can't get out. There's been so much creativity and activities. I've gone to so many car parades, driving around, and the residents are out there. There's been so much that has come from it that I think
Yeah,
long term will stick. So
that's good. I have a couple more questions that have come up. What is the hardest part about your job?
the hardest part about my job. Um, I hear a lot from people, I don't know how you could do that. You could see someone die or pass away, or um, experience that with them, because it is a sad time. It is a sad time. But for me, it's an inevitable part of life. None of us are going to live forever. So to be able to take that part of life and make it as peaceful and respectful and as loving as possible, supporting not only the patient, but their friends and family, to just make this such a beautiful transition. I think that for me is just almost the most rewarding part, but it is the part that sometimes can be hardest too. You have residents from when I was a direct support all the way to hospice that I would get so attached to, and just, you love them, you do. And when they would pass away or get really sick, we would take days off, we would grieve, and we would go to the funerals, and it's hard. So I think that's the hardest part, but in turn, it can also be the most rewarding part, especially when the daughters come in the next day and they would bring us flowers. They would pay for lunch for all of us and tell us, what a difference we made in their mom's life. And that's enough for me right there. It was great. So, but I think
No,
it too can be the hardest part.
I can see that. The other question is, how do you personally combat burnout or practice self-care, especially in those kind of situations, like you were saying, maybe taking, if your boss allows you to take a day off, if that happens, but how do you practice that?
Yeah. I think outside of work, there's a lot of things you can do. I have a very supportive, husband who is magical and is never stressed out ever. I don't know how he does it, but he always can talk me off the edge. So having, I think, a really supportive person, whether it's like a sister, a significant other, or mom, that can really put things into perspective is really, you always need someone. We need other people. So having someone you can talk to, or coworker even, to express, just frustration to, or to vent to appropriately. I think yoga and meditation, don't knock it. It's really great. So you try it. That is very fulfilling. Really just putting your phone down and taking time in the bath or in your room to just sit and be with yourself, I think is really important. In the workplace, if you just need like 5 minutes to cool off after the resident refused their shower 6 times or something like that. I think a lot of the times I was able to set mental boundaries for myself, that I wasn't going to put all my energy towards, maybe a resident who was being non-compliant or, verbally aggressive or something like that. I wasn't going to put my energy towards that. Okay, I'm not going to push. Today's not their day, or, this hour is not their hour. So I think focusing on what you need to get done that day versus focusing on what the residents will allow you to do that day, and giving yourself and them more freedom, kind of helped me, not just looking through my task list and feeling overwhelmed. I think starting my day with who likes to get up first, who enjoys what for breakfast versus what they have to eat for breakfast. So, trying to marry those two, I think, really helped me to not feel so overwhelmed like it was a job, more of just, a life, me helping take care of these people in their home.
Absolutely. Absolutely. Well, last question. Think about a final word of wisdom that you might have to share with students. So think about yourself, junior, senior in high school, maybe even middle school. What would be those words of wisdom going forth?
Listen to your teachers. Listen to your teachers. They know what they're talking about. I know it's hard to believe that they know more than you, but they do. I let my CNA expire, and that was that was naughty. And Miss Andrews always told us, don't let that expire because you never know when you're going to need it. And I'm like, I'm not going to need it. I have my MA, but guess what? Just because you have your MA or your RN doesn't mean you can do CNA work. Doesn't mean you can, do other types of things. So you really got to hold on to that stuff. And it's not hard to hold on to, but keeping track of that stuff, I think, is important. So, and again, if that still is an opportunity at the CTC to do farm tech or CNA, and you're one of the few people that don't want to do it, do it. So it's so fulfilling. I think everyone that didn't do it in our year went back and did it after they graduated and had to pay the couple $1,000s to do it because they chose not to during that time. So I think listen to your teachers is a big one, but also be flexible on yourself. Just give yourself time to learn what you like, and don't feel bad if you switch your major a few times or want to go into something bigger or smaller. There's no right or wrong way to help people. So, yeah.
I think that is great advice. And, Hannah, I think that you have shared some valuable nuggets for those students that are looking to go into healthcare, those beginning steps, maybe building towards nursing. So I appreciate you taking the time today. And so, as your mom, so proud of you and the journey that you have led and the life that you are building for yourself. So I thank you for taking the time today. Thank you all for joining us for this Future Focused. And we will see you next week when we have another series. Thank you so much, Hannah.
Thank you. Bye.
Bye.